invite her for her talk, which is Andhra Pradesh State Ophthalmological Society talk on role of skin prick test in allergic eye diseases.
Good morning, everyone. Thank you so much for giving me this opportunity. Today I'll be talking about the role of skin prick test in allergic eye diseases, still an ignored practice in India. We all know the complications of allergic eye disease, be the disease proper causing the complications, or the mechanical factors, or the treatment we use. And there are a variety of consensus which give us about the protocols to follow the treatment of allergic eye disease. And in all of them, the first step is identification of the allergen and avoiding the allergen. But are we really doing it? So why to identify and how to identify? Why to identify? Prevention is better than cure. So avoid the allergen, half of the problem is taken care of, and counseling the patient is very important based on the type of allergen. And also there is immunotherapy available, which is low dose allergen orally in the form of drops, which is given over 3 to 5 years, where there is a slow desensitization for that particular allergen, and it cures not only the ocular symptoms but also the systemic symptoms. So how to identify? There are a variety of tests, of which skin prick test is the most simple and sensitive and specific to about 90%. When we searched for studies, we found about 16 global studies with 1,173 patients, but we couldn't find any Indian studies. So our aim is to identify the common allergens causing allergic eye diseases and to study the demographics. We did a prospective study from March 2023 onwards with a sample size of 59 patients in children attending pediatric ophthalmology and squint clinic in our hospital. We included VKC of all grades and in children who are symptomatic for more than 6 months, aged between 3 to 20 years, and excluded any symptomatic patients of less than 6 months. When a child comes to us, be it a new or old, under diagnosis, a proper history is taken and an inquiry into family history and systemic symptoms is also made, and a diagnosis of acute or chronic VKC is made. If the symptoms are less than 6 months, the child is treated, but if more than 6 months, if it's acute, the child is treated, and if it's chronic or in resolving, all the steroids and immunomodulators, antihistamines are stopped for 15 days, and then the skin prick test was done by an allergy specialist. The panel of allergens used range from dust mite, cockroach to the commonly available plants. The skin prick test was done by injecting the allergen to the forearm or upper back, and positive is more than 5 mm of induration compared with histamine or saline control. Coming to the results, males were 3 times more commonly affected than females, and the most common age group was between 3 to 10 years, which also followed the gender distribution. Positive skin prick test was seen in 76% of the children. And among the positive people, systemic features were more prevalent. And sneezing was the most common systemic association. And among the allergens, dust mite and cockroach were the most common allergens, followed by plant allergens like Ricinus, Parthenium, Cassia, and sometimes even a dog and cat too. And 1/3 of the patients showed at least more than one allergen positive skin prick test, and females showed a higher positivity rate for plant allergens. And cockroach was seen more prevalent than dust mite in the older age group. In India, dust mite is still the most common allergen, followed by cockroach. And compared to the previous studies, most of the studies had a 70% positivity rate, and males were more than females, which was also almost same in our study. And house dust mite was the most common allergen, except in Spain where it was pollen. So to recommend, when a child comes to you for allergic conjunctivitis, always ask for systemic symptoms. And early morning sneezing is an important symptom to implement dust mite and cockroach control strategies. Try to identify the allergen involving an allergy specialist and counsel the children and parents for allergens avoidance strategies. And if possible, and if affordable, refer the child for immunotherapy. Few control strategies. The pitfalls being the commercial preparations which are being tested contain only few concentrated proteins, and negative tests are not always negative. And affordability of the test and immunotherapy are a bit on the costlier side. These are my references. Thank you.
What is the percentage you related to eye allergy and systemic allergy? What is the percentage you found in relation to systemic allergy and eye allergy?
Around 60 to 70% of the patients with among ocular allergy, around 60 to 70% of them had systemic features also. Okay. And if it's a had systemic features, the skin prick positivity rate was very high.
What was the general cost for the whole test which you used to
The test
send?
costs around 2,500, but the immunotherapy is costly. It has to be for over 3 to 5 years, and for every 3 months, it's 8,000 rupees.
Any relation to food?
We didn't find in our
Have you tested for
allergy.
any relation
There
to
was,
food?
we tested, but in our study, we didn't get any relation to food. We got mostly for cockroach, dust mite, and plants.
So did this change your management of these patients?
Yes, ma'am, very much. Because who are all affordable, we started them on immunotherapy, and there was a good relief of symptoms. And we have few extreme children who had gone to keratoconus with vision loss, and still they were rubbing their eyes, their systemic, they had ocular allergy, they had systemic allergy, but once they were started on immunotherapy, all the symptoms came down. So at least the progression of the disease had stopped.
So what was the exact immunotherapy you...
Madam?
What was the exact immunotherapy
Immunotherapy
regime
is,
that
it
you-
comes in a customized bottle, customized vials. According to that particular patient, it has to be maintained in a cold chain. It will be delivered to your house. It is usually taken care by the allergy specialist. They give the low dose allergen. If the child is positive for dust mite, it is that dust mite allergen where there is a desensitization for over 3 to 5 years. It will be in the low dose.
So it's a systemic therapy?
Yes, ma'am. It's oral drops,
Oral drops.
oral sublingual drops. Mornings, half an hour before, half an hour after, the child should not eat anything.
And where did you get this allergy test done and the specialist? Any particular preference for that?
Usually they are available, ma'am. Now it usually a pediatrician, dermatologist, ENT or a physician. Usually these are the 4 people who can do that course and they can do the test.
So with the number of allergens we have in our country, it is very difficult to pinpoint what is the commonest cause of allergy in these cases. And many times, though we have pointed out one of it, it could be recurring because of some other cause.
Sir,
So with that, do you think this immunotherapy which you are giving will be kind of a blanket for all other allergens as well?
Sir, actually this study is going on in the second part, and we are trying to study the features of the children who had multiple allergens positive, but immunotherapy is not available for all of them.
All of them,
It's
right?
only available for dust mite as of now in India. But even with dust mite treatment, their symptoms have, if the child had positive for dust mite and a small positive value for cockroach also, the child was responding for the dust mite immunotherapy.
Okay, that's great. Thank you.
Thank you.